Welcome back. I'm Dr. Janine Virch. I'm a neonatologist at Stanford Children's, and I saw you during the Pediatric Device competition right before this. So of course we have winners every year, and then we are always so proud of them. We want to know what they're doing next. So this next panel, we have 3 of our former winners here with us today. They're all going to be virtual, but we're really excited to chat with them about what they've been up to since they've won their award. So I'll allow them to each spend a little bit of time, a couple of minutes introducing themselves and telling us a little bit about what they've been up to in the past year or two, as the case may be, and then we'll go on to additional questions. So first we have Annalisa, the CEO of Reos, who is one of our 2021 winners last year. Congratulations. And we have Dr. Sophie Charlotte Hofferberth, who is the co-founder and CEO of Otis Valve Technologies. She was also a winner last year. And she also spends her time as a CT surgery resident at the Brigham, so she's definitely a busy lady. And then we also have Andre Bassett, who's the CEO of Eclipse Regeneris, which is a company that won 2 years ago. But I'll allow them to each introduce themselves. So Annalisa, do you want to go first?
Sure. Annalisa Samara, CEO of Reos. Briefly, Reos is a clinical stage VC-backed medical device company developing a platform of wearable skin sensors that can assess bodily fluid flow subdermally throughout the body, and we're initially targeting hydrocephalus in the neurosurgery suite.
Good afternoon. Thanks so much for the opportunity to be here today. My name is Sophie Hofferberth. I'm CEO and co-founder of Otis Valve Technologies. We're developing a expandable pulmonary valve for children. The company is based in Boston. It's a spin-out of Boston Children's Hospital, where we've been working on developing the technology since 2016. And we'll get into this a little bit later on, but the company has worked through preclinical phase and now implementing a first-in-human clinical study in the US for this technology.
Andre?
Hi, Andre Bassett, CEO and co-founder of Eclipse Regenesis. We are a tissue regeneration technology or mechanical device that actually stimulates the body to grow new natural small intestine as a solution to pediatric short bowel syndrome.
Well, you guys are amazingly brief in your introductions for such accomplished individuals. So thank you for that. But as you can see, there's such a breadth of interesting technology that we get to see through the Pediatric Device Consortium and help support. So you guys are all active entrepreneurs and innovators. And I know I want to get into a lot of different questions today about how challenging it is in pediatrics and how we can make that landscape a little bit easier and just further that conversation. But first, I want to talk a little bit about your involvement with the Pediatric Device Consortium, or specifically what the funding has allowed you to be able to do in the last year or two. So whoever wants to start can start, but the question will be for all of you.
I'll go. So we actually got funding, again, 2 years ago, the most recently, but we actually won even the year before that too with
Yep.
UCSF Stanford. And previous to that, we had actually raised some consortium money from CTIP down in Southern California. And that really helped us get started. That was some of our first initial money as a company, as we were translating out of academia to create a company to pursue this opportunity. And so I have to thank, obviously the whole entire consortium for their support and getting us off the ground and up and running. The latest round of funding we got really helped us get into the manufacturing process. And that's where we are today. We have submitted our IDE for our first in-human trial. And again, thanks to the consortium for their support.
Of course, we're always excited to have Pediatric Technologies. Now, Andre, you've raised quite a bit of money. Are you able to disclose, what that is and how you've gotten to this point and how much it's really taken to get to this point?
Yes, yeah. So we've done a number of different funding sources, including SBIR grants, and then convertible note with private investors. And that really, on top of, the consortium grant money has helped us get to where we need to be. A lot of obviously work to go from, an academic concept to a commercial product, or even a product that can go through FDA clearance for a human trial. And so that allowed, the first initial money really allowed us to kind of tell our story, get up and running, and go out and pitch. And so we have been, continuously pitching and raising money as we go. That never stops. But it did help us. It was a good stamp and seal of approval that I think our first investors gained a level of confidence in us, knowing that we hadn't gone in front of the consortium, in front of UCSF Stanford, and rose to the top in the pitch competition. And so our story worked, and we were able to raise some money to get going. But onwards and upwards, we continue to raise and continue to pitch and tell our story. So,
well, it's great to hear that it's not just the actual financial backing, but then also kind of the seal of approval as well. Annalisa, do you want to go next?
Yeah. I will say, with the, PDC win last year, that really opened up a new network for us. We definitely have taken advantage of the resources of, both Stanford and UCSF. We're actually trialing with both of them right now. We've also gotten introductions to neurosurgeons. So, I think it was, Dr. Wall and team who introduced us, to Dr. Grant over at Stanford. So we're working with him. And working with a couple of neurosurgeons over at UCSF too. Beyond clinical, I'm always asking, the PDC for help on a number of things, maybe, picking brains on, on the VAC process, bringing in, technologies into hospitals, that sort of thing. So I will say that, while the cash award was nice, there was a much bigger award in the network that Stanford and the UCSF PDC provided Reos.
That is very kind and generous of you. Sophie?
Thank you. Yes, I would say that there was, several benefits to our company specifically, and learnings, even from the application to the consortium to the PDC last year. So, just from, these are obviously thought leaders in the pediatric space, individuals who have significant amount of experience in developing pediatric devices, also commercializing, and they understand all the hurdles. So I found that even, preparing for the pitch competition, there was, learnings that really benefited also in how we presented the technology then to, even for FDA submission, FDA, but then specifically with grants to the NIH submissions, as well as speaking with investors. And then on the, through the pitch competition itself, there was excellent feedback that, really provided guidance for how we proceeded forward. And then, frankly, the funding that we received through the award last year came at a critical time. We were able to really propel forwards with our manufacturing steps and the execution of critical testing that was required to proceed towards an IDE submission for a first-in-human early feasibility study. So those were sort of, even just in the lead up to the consortium event, and then really getting the funding, that was really pivotal.
Thanks for that, and I hope that some of our future PDC winners are listening to take advantage of some of those resources. We're always thrilled when any company wants to come and talk to us and think about additional ways that we can help, because we know it's not just about the financial investment, that there's a long, hard road to pediatric med technology development, which I see you guys nodding. We all know we've been there, and we continue to be there, and it's the world in which we live. So I guess thinking about that a little bit, what has been, for each of you, or what do you anticipate to be the greatest challenge innovating in the pediatric med tech space? And that can range from anything. You guys can choose. So why don't I start with Annalisa this time?
Sure. I think there's so many challenges to begin with, trying to develop a device in the pediatric space. But I think, I will say, like, during our seed round raise, which we closed, last December, I think the biggest challenge for us fundraising was to get investors excited about the population that our technology is addressing. There's this misconception that, the market size is too small. There's all these regulatory, challenges for the population on top of traditional, med device regulations. So they see, or at least they saw me and our company as having, all these hurdles, without, it was like a misconception, right? So I think, that's just, that was a huge hurdle. And I know that, there's other, friendly medical devices, companies that I know of that are also experiencing something similar, where they're just like, how do we get over this hump? How are we, kind of just not like, typecasted as being, something that, won't see the commercial light of day. So, it takes some work and extra effort to, convince the investors, strategics, that sort of thing. But, definitely with the right support, it can be done.
Yeah, thank you for that. I think that's something that we all share. Just even being able to get your foot in the door when you say the words pediatric or even maternal or fetal, certainly is a challenge that shouldn't always be there necessarily when you're looking at the market. Yeah.
Yeah, if I might add, I think Annalisa's right on with the challenges with fundraising. Traditional medtech venture and traditional investors, want to see the ginormous, markets, and you start saying the word pediatrics, and they start to, shut down and kind of maybe glaze over a little bit because they view it as small. But I think, another challenge, with pediatric innovation is really the traditional mindset of innovation, where you take a new device to adults first and then migrate it down to children. Whereas we're saying, look, we want to start in this need state, this need population of these kids. And a lot of times people that throws them off. They get a little bit hesitant, whether they're administrators or, even regulatory. They still, I think, struggle a little bit with, kind of the traditional mindset of start with an adult and then move down, don't start below and then move up. So I think that's definitely a challenge I think we face probably across the board.
It's so interesting because I think one of our premises and something we talk about all the time is this miniaturization of devices. And as a neonatologist, that's something that absolutely drives me crazy because my patients have such specific needs. And, a 23-week neonate is not the same as a 70-kilo male adult. And miniaturizing what we give to them isn't always the right answer. So how have you guys been successful in starting to have that conversation or convince regulatory agencies or funders or people that miniaturizing isn't the way to go? I've certainly had talks entitled that, but I'm not sure that we've moved the needle there.
Maybe I can start with that. I guess there's multiple fronts to addressing that. Firstly, I believe that it's about coming up with technology that is actually designed for children. I think that really, begins the discussion rather than, I can speak to sort of the heart valve industry, for example. And, there was white papers that were written, let's say a decade ago, and they were literally talking simply about downsizing adult valves for children. So I think that firstly, the innovation that we continue to pursue solutions that are genuinely, designed for children, that's sort of, begins the discussion. And then secondly, it's really having, and I believe, certainly in our experience, the, FDA is very much supportive of the pediatric space, and they have, open to collaboration, and, having that, the building the dialogue towards testing requirements that are actually geared towards children rather than having the same benchmarks in terms of, let's say regulatory testing requirements as one sees in the adult world. Because once again, even from a durability standpoint, we can, go through all the different disease processes and how it's not relevant necessarily for a child. For the duration of a device, the lifetime of the device may be very different than for an adult. So I think it's really important to, to be advocates for our patient populations and continue to innovate and to really, communicate and build the relationship with the regulatory as well as key industry stakeholders.
Yeah, I couldn't have said it better myself, for sure. I think that we're so grateful for our partnership with the FDA, and our conversations with them have always been very encouraging to the field of pediatrics, and that there really is a desire to want to learn more and to create those pathways. But I think there's still a lot of work to be done to create those, to acknowledge that. Go ahead.
I think Sophie brought up a really great point, which is, kind of the requirements and regulations for a pediatric device being, different. It's so true. And I think sometimes that's another challenge we face, but it's also, I think, when maybe we'll talk about this in a minute, but what would we want to change, in this world, in this realm that we live in? And maybe it is, truly a specific pathway within the FDA and regulatory for pediatric devices, because they are so different and they have different requirements and including just even different sizing, right? I mean, it's such a challenge that we face that, that could be, I think is perhaps what we're hitting on here is the differences and the challenges we face. And it's kind of like, round peg in a square hole. Sometimes it just doesn't fit, right?
Yeah. Well, since you brought up that point, why don't we talk about if you could change anything in the pediatric medtech landscape, and how innovation works in peds? What would you change? What would be the number 1 and 2 things you'd change? Annalisa looks like she wants to talk.
I like Andre's idea of having, just a section for, on the reg side for, for peds devices. It's so challenging, not having that and, having conversations, with the FDA, trying to get them to understand, the patient population and, the size requirements of the device, that sort of thing. I know there's, groups like AVAMed, they have like certain subsections they're trying to, help the cause in that. But I mean, I think if that group is established with the FDA, I think you'll see a lot more innovation within the pediatric device space.
So I guess I would just to sort of build on that point. I think if there's one thing I think would be, potentially could change the landscape would be if, from an industry stakeholder standpoint, we can also appreciate, what the objectives are and the requirements for, large medical device companies. And if there was a way to incentivize them to pursue pediatric device development, if there would be some type of, relationship or agreement between the FDA and, industry stakeholders, that could potentially drive or promote the development, or that these kind of type of companies actually can see that one, it could be there's like Andre was saying about a different pathway potentially for regulatory approval pathway that's clearly designed for a pediatric device. That could be one way, but also from a financial standpoint, especially when you have, niche markets where it's clearly children that very definitely there is the clinical need. And, certainly right now there's a number of pediatric patients that don't even get treated at all just because, we haven't been incentivized to develop anything for them and to get it all the way to market. So those are some thoughts I had about, potentially thinking about how one could overcome some of the big challenges.
Yeah, I think, following that too, I think also a huge need area would be in the reimbursement world too, because, you have regulatory and then you're going to be right over talking to CMS, Medicare, Medicaid. Kids, they're not, Medicare, they end up a lot of times being, in the Medicaid, at least what I'm dealing with. And that's a whole nother world that's just very, very not efficient, let's say. And if there was, again, working between FDA and CMS, if there, again, is these partnerships that could happen, but making sure that pediatrics gets its own little world because it is different and these are different patients, not not 65 and older that fall into Medicaid. That seems to kind of dictate even private payers and their coverage policies and everything else that we see. So challenges there for sure in pediatrics, getting it paid for.
I'm going to copy Andre again. So on the reimbursement side, that's such a huge point, right? So like when MCIT was a potential thing. So Reos's device is breakthrough, right? So when we got it, we're like, yeah, but a lot of the shunt failures happen in the pediatric population. So I'm like, oh, there goes the Medicare outpatient benefits. And, we're dealing with kids here. So if there was like like a temporary coverage for breakthrough devices, or even just pediatric devices in general, where you're given a code, and that will allow you to generate that evidence a certain amount of time, right? I mean, that would be huge, because right now, if you don't have the coding, coverage, and payment, you're trying to figure it out. Mm-hmm. So I think like a nice path specifically for PEDS device would be huge.
And that would help fundraising tremendously.
Oh, yeah.
That, it'd be a different conversation with investors.
Yeah, it's so wonderful to have you guys here, because you're really taking this conversation to the next level, right? So we have our academic community who is starting off in innovation, trying to understand what that is, interested in pediatrics, but then how do you build it into a company and a sustainable business? And then how do you create a sustainable business that can actually get to patients? And understanding that pathway is challenging in any device, but being able to be successful in that pathway with pediatrics is certainly something that we're continuing to try to explore and build upon and have some examples of. But it's wonderful to speak to you guys to hear what the hurdles have been. But in order to do that, you all have to have a sustainable business model, which you all do. So, sometimes pediatrics, we talk about, people that say, oh, well, it can be a philanthropic company, it can do something else. But how have you all created, and what is your business model? Have you created a sustainable business model that actually eventually get your technology to patient care?
Sure. I can go first. So the product that we're looking to bring to the market first, hopefully before the end of the year, knock on wood, will be used in the hospital. So it's a single-use disposable wearable sensor that can be used both on the inpatient side as well as ambulatory care. So on the inpatient side, we'd leverage existing DRGs. On the outpatient side, we have to figure it out, right? Like a lot of new technologies, that sort of thing. So we're going to gather evidence, that sort of thing. So that'll be single-use disposable. So that's the model on the hospital side. We're following up with a home device for remote patient monitoring in a couple of years, and that will be a reusable, rechargeable device with a disposable, like a replaceable adhesive component to go with our sensor.
Yeah, I think our business model really kind of focuses on the value proposition, both clinically and then economically. With short bowel syndrome, yet not only is there a huge unmet clinical need to be able to restore tissue and return natural ability to absorb nutrients, there's also a huge economic burden that keeping these patients alive on home parenteral nutrition, hormone therapy that goes with it. It's going to be upwards of $500,000 per patient per year. And so I think our part of our what kind of connects with investors is the opportunity to address a huge economic need on top of a huge clinical need. So I think that's kind of really where our business model is focused in terms of the value that we need to present to both the clinicians and the investors and the patient, of course.
Yeah, lots of value propositions. No one fits all, I'm sure, but a lot of different stakeholders in this as well that you have to address with different levels of data. Sophie, have you put thought into your business model? And yeah.
Certainly a lot of thought into it. I think that sort of from very early on, we have it's a heart valve. It's a class 3 device. There's a very long pathway to market. It's very clear that we had to have a technology that is differentiated and can address an unmet need. And for us, it's really the expandability of the device which makes it unique, and that can accommodate growth of the child. And for us, it's really been proving that sort of, in that preclinical setting, and now we're just entering early feasibility study, but it's from the investor standpoint and again, sort of, key industry stakeholders, it's been, very much a focus on demonstrating the clinical benefit of having a device that, can expand to grow with a child. But then also sort of along with that, long term, there would obviously be significant economic benefits to, preventing repeated, invasive procedures. If a child could avoid, for example, open heart surgeries to replace outgrown valves. But that has been something that, as we've learned more about reimbursement, at least in the current system, this is where things can get complex. And certainly we've, been really focusing on, the highlighting and demonstrating the true unique aspect, which is, growth accommodation for a heart valve.
Great. We commend you for taking that very long, challenging pathway, because some of these technologies need that pathway. In fact, to be safe and efficacious in our patients. And I know oftentimes in pediatrics, people shy away from a PMA or something with more regulatory burden, but we need those too. So I was just notified that if anybody from the audience wants to contribute questions, we can start to moderate some of those. You can put them in the Google Forms in the YouTube description, I understand. So hopefully that makes sense to people. And if anyone in our audience here wants to ask a question, we can certainly hand around a microphone as well to be able to do that. While we're preparing for other questions, feel free to bring up anything you want, but I especially want to know for some of our newer entrepreneurs, what types of funding sources are you using? I've heard you speak about SBIRs and I-Corps, and they might not all know what that is necessarily. And VC and venture funding, so there's multiple levels of funding, whether it's grant-based or investor-based. But if you want to talk about creative ways you've been able to fundraise for your company too.
I can start. So REIS has a mix of non-dilutive as well as dilutive type funding. On the dilutive side, we closed oversubscribed seed round of about $2.2 million last December, which is great, but $2.2 million is not enough to, launch a device and do clinicals and, do other fun things, right? So, which is, why, we sought more funding, by way of the, SBIR and STTR. So, a couple of team members, myself included, have been, PIs on other SBIR grants. And it's just one of those things, like, I feel like we submit every cycle. I think we do. I'm pretty sure we do. And so we have a fast track NIH grant, so phase 1, phase 2 for $4 million. We also have a phase 2 NSF grant for $1 million and a couple supplements that way. And then in addition to, those huge grants, we've done things like pitch competitions, that sort of thing, because to bring these devices to the market is expensive. You gotta, not only on the technology side, but on the team side, really talented people, get paid nicely, that sort of thing. So, so for REIS, I guess in a nutshell, it's both dilutive and non-dilutive.
Yeah, we see a lot of pediatric companies taking that route, since there are those options. Andre, do you have other thoughts?
Yeah, no, I think Annalisa is a professional at getting these grants. I commend her for how much you've done, and thank you for. I've spoken to her offline about grants. I think we've been fortunate too to get both NSF, National Science Foundation, and then NIH SBIR grants, which are great. But I will say to all, kind of people just getting into this space, they can take a long time. And for me, it took, almost two or three times. Third time was the charm where I finally got it. So, and that, these can take up to a year to submit and process and get responses back. So the first couple of years, if I hadn't raised, private money, we wouldn't have any, I can't wait for these SBIR grants to come in. But do put them in and do stay focused on them. Like Annalisa said, it's a great flow of, non-dilutive money that can keep coming. And some people are able to survive solely on that. I have seen a few companies do that. It probably has to be the right, product and company that, that can do that. But that's been really good for us also. And, then I think, really getting into the investor network, you got to find it with pediatrics, you really got to find the right investors that are going to join your mission minded, focused on what you are looking to do, and aren't really just looking for a 10x return for their portfolio. Sometimes pediatrics is about a passionate endeavor and making sure everybody kind of on your team is kind of going in the right direction. And then those networks of investors are out there, and they might be hard to find. Like Annalisa said, you got to go out and be pitching and talking and selling. But once you find people that understand your mission and your cause and want to join your group, then that's when you can find the private money that goes with it too. So it's never easy.
Okay, we'll take a question from the audience.
Hi, Janine. We do have one question submitted that says, we have a difficult time finding prototyping resources for early innovations and understanding how much we can expect a prototype to cost. I wonder how other pediatric hospitals create prototypes, shared internal resource, outsource, other.
So it sounds like it's coming from an academic environment asking about prototyping resources, which I imagine it can only be heightened as a private company as well. Is certainly within the institution, we have our own resources, and you're able to use, lab resources and biodesign resources, et cetera, because all of the IP from the university belongs to the university. But as a private company, I'm sure that can lead to other potential challenges. I don't know if any of you have experienced that, or outsourcing prototype development, or even manufacturing development.
Yeah, I mean, we've been nearly virtual as a company in terms of our product development and manufacturing. And so I mean, you gotta have some money to outsource, to pay these people to do the prototyping and get the manufacturing set up. No one really wants to do it for free, which can be a little bit different if you have resources at an academic university, maybe students or postgrads that can work on things, doing prototyping in the lab. But once you're kind of over in private industry, you got to pay for it. It's that's just what it takes.
And I would just add to that, even in the during when the device was when I was working at Boston Children's, there was some prototyping requirements that just went beyond our either engineering capabilities or even from a material standpoint. So we also even outsourced from the academic, when we were still working from the hospital, and there was working essentially, then have a subcontract, and then ensuring that from an IP perspective that everything belongs to the institution. That usually is not a problem though. So we were then kind of, and then also I guess look in the local community in Boston, there's other academic institutions where we then sort of piggybacked on their resources. So that was a couple of ways that we overcame that.
And I'll just say for Reyes, so the company came out of Northwestern University, so very early versions of the device were handmade in the lab, which is great for if you just needed a few devices, right? So that works for like an N of 10 or lower. But if you want a huge lot, that sort of thing where it's manufacturable, you have to get out of the lab. And fortunately, there's like a ton of PD firms out there. I mean, all over the country, all over the world, that sort of thing, that can work with early stage companies. So Reyes, when we transitioned, there was only one employee at the time. That was me, and like a consultant. And so we, contracted with a PD firm because we didn't have the cash to work with a contract manufacturer in Minnesota. Like those guys are super expensive. So we took that was a less expensive route for us to work with a PD firm because we didn't have the in-house engineers to, build some prototypes, that sort of thing. So, we did that, got a prototype. able to use that for show and tell for devices, that sort of thing. And, that brought money, then we could, hire people, that sort of thing, that, made additional prototypes then in-house. And then we worked with a contract manufacturer. So it's kind of scrappy, but, you kind of have to be that way sometimes with these companies.
No, I'll second that. I think, Eclipse probably very similar to Reyes in terms of, where we came from. And I would, maybe advise or counsel that just, spinning up a few prototypes in the back of an academic lab is far from what is actually needed to get through regulatory. And that's where this ginormous leap happens, right? And when you get into a quality system and you get into the manufacturing and all the documentation and the biocompatibility and everything that has to go into that, submission to the FDA, that's a big process, and not to be underappreciated. I think it's a big process, takes a lot of time, takes a lot of money, and it's definitely different than prototyping for sure. So you'll get there. That's the goal.
Eventually. Yeah.
And sorry, I would just add to Andre's comment, which I think is really critical, that also planning ideally would go into the timing of that transition, because it can actually take a significant amount of time to transition from having, lab prototyping to a device that you can even present to the FDA to begin the regulatory approval process.
What do we always say? Twice as long and 3 times the amount of money?
At least. Absolutely. That no true words were ever spoken, but I know we're wrapping up in a couple minutes, so this has been absolutely wonderful, and I'm sure you've inspired a lot of future innovators or entrepreneurs or people to get into the pediatric space in and of itself, because kids are the best, and we really all enjoy the work that we do, and our patients certainly need it. But what advice do you have for people wanting to get into the pediatric medtech innovation space?
Well, I'll go with one. I learned this from my co-founder, Dr. James Dunn, there at Stanford, and he said there's 5 P's to pediatric device innovation. That's first one, P, preparation. You got to go out and know the unmet clinical need, right? Be prepared. You got to have passion. You absolutely need to be passionate to be in this space. You need to be persistent. People are going to tell you no. People are going to deny you. They're going to say you're crazy. Don't do that. You got to stay persistent. And you're going to have to work hard. So perspiration, P, you're going to work hard in this space. It's not going to be easy. And then people, I think people is key. Like I was mentioning before, just making sure the right people are on the team, heading in the right direction with the right mission, both, with clinicians and with employees. And, really people are what make this industry move forward.
Absolutely.
And I think in the list of 5 things that Andre said, like the persistence really, stands out for me, right? So, when we were raising money, that's kind of like when the pandemic hit. So, try to raise money for a pediatric device company during the pandemic when I have 2 small children at home that are, at school. That was really, really tough. And I can't even tell you how many investor pitches and pitch competitions. I lost count, and I was doing it every day. Right. And it's just one of those things like that you have to have, the persistence, you have to have the patience, you have to drive, especially. And, there were times where I wanted to give up because it was just so hard. And then the thing that really got me to not do that are the patients and the caregivers. Yeah. So when I first started over at Reyes, I talked to a mom of one of our patients, and she's the one that locked it in for me, where she told me how difficult her life was, how she didn't work because she was taking care of her daughter. That was her, double full-time job. And I could just hear how much she cared about her daughter. And I was like, oh, I have to do something for her and other parents like her. So when I have my down moments, I think of her and I think of the patients. So, it's a long journey, but just remember your why.
Love it. Patients first, always. What's best for the patient should win.
Well said.
Sophie, if you want to wrap up.
Yeah, it really is all about the patients, and the other piece as well is that we should, continue to keep dreaming and being innovative, because ultimately that's why we're all here, presenting these projects and giving updates. But ultimately, it's just stay focused on the mission and keep innovating.
Thank you all so much. This has been such a pleasure to be here with all of you and have this conversation. Someday we'll get together in person again, I'm sure, but good luck on your mission. Can't wait to see all your devices on our patients someday, or in our patients someday, that is, or those conditions completely eliminated as well. So really appreciate your time, effort, thoughts, and continual persistence, because we certainly need it in pediatrics, right? Okay. Thanks, guys.
Thank you.
Thank you.
Thank you.